Good morning, everybody. Welcome to this conference, the joint meeting of Metro North Brisbane Medicare Local and Metro North Hospital and Health Service, putting patients at the centre of care, and a very appropriate topic for the moment. And there's going to be a lot of discussion over the next few hours about integration, and you're going to hear a lot of examples of that at work. And I think this, Brisbane, both north and south of the river, is showing great examples of integrated work and sets an example for the nation.
The Queensland Government has put on the table its blueprint for healthcare, and I think Queensland's achieved through the changes and the empowerment of hospital and health services, true empowerment. I think they've set the scene for the country.
We can think about many other places that provide services that engage with the consumer, with the user of the service, and they do that to learn. They do that to improve. So I'd really like to challenge you to think about, what do you know about the users of your service? What do you know about their experience, about their needs, about their expectations? And I think these are very much challenging, but also changing.
Healthcare does become incredibly important and does make a difference to how long you live and how well you live. So the enterprise that we're all involved with in this room is incredibly important. It is actually making a difference.
One of the things that many of you who've been involved for the long haul with us from the division to the Medicare Local and all the years since, well, the 3 years since, you would have heard me talk on many occasions about the fact that one of the key things that we're meant to do as a Medicare Local is bring people together and talk about what are the population health needs and how can we address those in our regions. And we then put together plans, and we've been doing that for the last 3 years. But we then say to the government, here are our plans, here's what our community says that they need, here are the gaps that we've identified, but what can we do about it? We need funding, we need other influence and other mechanisms to enable us to actually do something. And that's one of the things that I think Medicare Locals have struggled with, is not having the type of funding or influence that we would need. My hope is that these new PHNs would have a bit of a different situation.
Map of Medicine is a tool that we're working with the Medicare Local to ensure that we have as much knowledge as possible, not only about clinical pathways, but these map of medicines that we're developing actually are designed by clinicians in Metro North with the individual names of those particular clinicians in our services that are the right clinicians, and also acknowledging the clinicians that have developed these pathways.
Much of what we've talked about today about putting consumers at the center of care, we have so far to go. There is really still so much more to be done, and I'm hopeful that we can really build on these things in the future, but we need your input and your help to do that.